All right, welcome everyone. Thank you so much for joining us today. Feel free to add to the chat where you're calling in so we can see who's on the line. We're actually going to get started right away and start with a poll. So if you scroll just beneath the video player and then click poll 1, you'll find the following question that we're asking you to consider and answer. Please select the one response that best describes the status of paid family medical leave or sick leave in your state. And you have 6 different options. So just pick which best describes where your state is today. Just trying to get a sense of who's on the line. And I'll give everyone a few moments to place their answer. If you'd like to better clarify anything, feel free to jot it into the chat. And as the results continue to come in, we'll take a deeper dive into those results shortly. But for now, I wanted to share with you that the US Department of Labor reports that 93% of workers earning less than $15 an hour have no access to any defined paid leave benefit. That represents 44% of all workers without access to any defined paid leave benefit. And furthermore, a 2018 report found only 5% of the lowest wage workers. And when I say lowest wage, I mean those that earn an average of $10.28 have access to paid time off. The US Bureau of Labor and Statistics notes that Black and Hispanic workers are less likely than their white counterparts to have access to paid leave. So during our next hour or so together, we're going to explore the state of paid sick and leave policies in this country. And given the global pandemic, certainly this topic has been on the minds of many employers, employees, perhaps and likely also the mind of legislative staff and legislators. Perhaps some of you on the line do already know the United States is the only developed nation without a national paid leave policy. So without a national paid leave policy, we see states and in some instances, cities taking matters into their own hands and crafting policies to affect their workforce. I'm going to take a quick little look at how you all responded to the poll just to get a sense of who's on the line. And it looks like the majority of people on the line said that we have enacted but not yet implemented a state paid family medical leave or sick leave policy. So that's very interesting. And the next biggest getter of votes indicates that you have both implemented and enacted. So excellent. I hope everyone takes away something useful from this session. So my name is Allison May. I'm a policy associate at NCSL's Children and Families program. And joining me today is my colleague, Suzanne Hultin, a program director in NCSL's Employment, Labor, and Retirement program. So paid leave really is a crossover issue. So we see labor and employment, finance and appropriations, health and human services committees, all talking about these topics, which is also why Suzanne and I both focus in on this policy area. Just a moment of housekeeping. I do want to make sure that you're all aware of the chat and Q&A function located on the right side of your video player. Please use both of those. If you have questions, add them to the Q&A. If you see a question that someone else has added that you really like, you can upvote it by clicking on the up arrow. Under your video player, you can find our bios along with resources for today's session. And lastly, if you have any technological snafus or issues, click on that help button on the bottom right hand of the page and someone will be able to assist. Suzanne and I are going to alternate sharing information and we plan to cover the items you see in the agenda in front of you. Again, pop in any questions you might have. We'll be monitoring that during. We'll get to as many questions as possible. And if we run out of time, we'll reconnect after the fact next week with some information. So before I do turn it over to Suzanne, I do want to share this final slide. And this just shows the employee leave benefits that exist. And they generally fall into these 4 categories. And each of these can be either paid or unpaid. So when we think about parental leave, it's commonly synonymous with maternity and paternity leave or time away from employment for the opportunity to bond and care for children at the time of birth, adoption, or foster placement. Family care leave is time away from a job to help a family member with a serious health condition. And then medical leave is to attend to your own serious health condition. So think about an operation and the necessary recovery period. And sick leave is time away for something less severe. So short-term medical conditions. So the flu, perhaps a cold, and we all know that COVID has impacted this conversation around sick leave. So I'm going to turn things over to Suzanne to dig into some of the details. Suzanne, the floor is yours.
Great. Thank you so much, Allison. And thank you everyone for joining us. So I am going to really start giving some dive into what paid family and medical leave is and what paid sick leave is. So for the purposes of this presentation, we are going to lump in parental leave, so including maternity leave and paternity leave into family leave, as parental leave is a type of family leave, and that's how most states who have enacted paid family and medical leave have qualified it. So essentially, family and medical leave is long-term leave to care for either oneself if you're ill or have a medical condition, or to care for a family member, or including welcoming a new child. Sick leave is short-term leave. So anything from a few hours, maybe for a doctor's appointment, or to a few days to take care of yourself if you have a cold or a child. Paid family and medical leave in most states is offered anywhere from 6 weeks up to about 12 weeks, and it's at a partial rate of pay. Whereas paid sick leave is accrued by hours worked. So usually one paid sick hour for every 30 to 40 hours an employee works. And one does receive the full rate of pay on paid sick leave. Family and medical leave also works a little bit like an insurance program, where in most states, both the employer and the employee, or just the employer or just the employee, pay into the insurance program. Paid sick leave, so again, that short-term leave is much more common in the United States. On the left side of this slide, you will see a chart, and you can see the rate of employees with sick pay has been on the rise over the last 15 years or so. Roughly there's about 3/4 of the civilian workforce who currently have access to paid sick leave. However, there are discrepancies in the access to paid sick leave. As you can see on the chart on the right, those who are making more money tend to have more ability to take paid sick leave, whereas those in low-paying jobs are less likely to have that benefit, especially those whose wages are around that $10 an hour, which Allison earlier mentioned. Access to paid family and medical leave, so again, that longer-term leave, is not as prevalent in the United States. However, it has been on a slow increase over the last 15 years, and it's becoming much more accessible in state and local government jobs, with about 1/4 of those jobs offering it. But also it's also rising slowly among private sector jobs, as you can see. Support of paid family and medical leave is pretty overwhelming in the US, about 80% support it. Although there is a divide on whether it should be mandated or left up to individual employers themselves to decide on providing paid family and medical leave. The majority of people agree that the lion's share should be paid for by the employer. This is becoming more of a bipartisan issue, with a majority of Democrats supporting this paid leave, and at least 3/4 of polled Republicans and independents thinking new mothers should have access to paid leave, maternity leave, and workers should be able to take paid leave to deal with one of their own serious health concerns. This past year, an unprecedented number of working Americans had access to paid leave through FERCA, or the Families First Coronavirus Response Act. Among other things, the federal legislation allowed workers to take paid leave if they had COVID symptoms, were confirmed to have COVID, or if they needed to quarantine due to exposure to the virus. The act also allowed for an additional 2 weeks of partial pay for someone to care for a sick family member who had COVID, or to care for a child who was out of school or daycare. And then finally, it also allowed for an additional 10 weeks of partial pay to care for a child who was out of school or daycare because of an extended closing due to COVID. The federal requirement to provide paid leave expired at the end of the year. However, private employers can voluntarily continue to provide that and receive a tax credit from the federal government. That is right now set to expire at the end of March, and it is possible that the tax credits could be extended in another round of stimulus. And so with that, I'm going to hand it back over to Allison to kind of tee us up for this next part.
Excellent. Thank you, Suzanne. That was really good information. Now what we want to do, and I hope this will be fun and maybe engaging for you on the line, Suzanne and I are going to spend some time thinking about and discussing the common arguments in support of and against paid leave policies. So there are a lot of variables also to take into consideration as you're crafting legislation. We're going to explore that a bit more later in the presentation. But likely the information that we share now won't be an exhaustive list. So if you have any thoughts about items that could fit in the pro or con list, I'd invite you to toss it into the chat. And I'm going to start with a pro. And I think one of the primary arguments in support of paid leave relates to the health benefits. And we see that in a few different ways. So we see improved child health with fewer babies admitted to the hospital and increased rates of breastfeeding, higher vaccination rates, and then a greater likelihood of well child and other timely and needed healthcare visits. We also see lower rates of maternal depression when mothers are able to take leave following childbirth. And of course, in your own personal health. So if you need to take leave and you have an ability to do it in a paid fashion, whether it be a few hours, days, or longer, that could be good for you, your family, and your employers.
Thanks, Allison. And those are all very good points and a great reason why new parents and oneself should be able to take leave. However, opponents might argue that paid leave should not be mandated, but instead left up to individual businesses to decide what works best for them. They may also argue that the burden to pay for paid family and medical leave should not fall on businesses, especially smaller ones who may not be able to afford to pay into the insurance program. I think it's important to remember that while someone might be on paid leave, the small businesses also have to manage the extended leave of the employee. And this is the same for paid sick time. Businesses pay the full rate of pay for sick leave taken, and that could be a hardship on many small businesses, especially in states where a minimum wage hike was recently enacted or is being considered.
I think those are all very good points, and I agree with you, but I also want to share, leaving it up to businesses may mean that some people are left out, so namely those that are in lower wage jobs. So a continued connection to the labor force is really important, and these policies can help make that a reality. So a few examples: paid leave keeps employees connected to the workforce, and that can benefit families and employers. And additionally, it could allow for the workers to continue scaling up the job and pay ladder. Also, a paid leave policy could help businesses in keeping costs down that are particularly associated with hiring and training new employees. And I know not long ago, I read a survey conducted by the Bipartisan Policy Center, and what they found were over 60% of small business owners that responded thought that paid leave could have a positive impact on employee morale as well as retention, in addition to the ability to attract new employees.
Okay, I understand that, Allison. Keeping employees engaged in the workforce is important, as is keeping employees' morale up and retention. But let's talk about the solvency of the insurance funds. How can states accurately predict the amount of paid family and medical leave the workers will take and ensure they are putting into the insurance fund what they hope will cover the leave? We are seeing right now the solvency issues with many states' unemployment trust funds. What happens when a paid leave fund is not solvent? Would it then fall on the state to cover the gap? State governments are not in the position right now with budgets to help out paid insurance. Furthermore, it should never be the role of state government in providing the leave. Paid leave is a benefit to employees, not an entitlement that all should have. And during these tight budgetary times, it's just not realistic. Finally, would providing paid leave benefits cut into some of the other benefits or pay that employers are already providing their workers, some of whom may never even use the paid leave?
Good points. I want to shift gears just a little bit. And I do want to mention the opportunity for parent and child bonding following the birth, adoption, or placement. So perhaps this is more in the vein of paid parental leave, but research really indicates that the early years of life are particularly critical. And what babies need are caring and nurturing caregivers in order to feel safe and secure and be able to thrive. So policies that allow for paid parental leave can help to make that happen. I've also read some research showing a link between paid leave benefits and overall child safety. And then child welfare experts note that parental leave, along with other family-focused workplace accommodations that exist, can help new parents and babies to form positive attachments. And that might prevent family dysfunction, abuse, or neglect.
Great, that's all true and reasonable, Allison, but I think there's a gap in the research. We need additional research on how to design the most effective paid leave policies, because what currently exists is just insufficient. More needs to be done to determine what's the right duration of leave and how it should be funded appropriately. And onto a final point, many feel that publicly funded paid leave is just an inappropriate and unrealistic expectation of government. I mean, let's let the market be the deciding factor.
Again, everyone, that was just our impression of some of the most common arguments we hear against paid leave and in support of paid leave. Again, if you have anything you want to add, do feel free to do so in the chat. I think now what we're going to do, I'll turn it back over to Suzanne. She's going to share updates and additional key features and some stats around paid sick and family medical leave, and to highlight 2 state examples for you all to consider. Suzanne?
Thank you, Allison. Yes, that was fun. So let's take a quick look at what states currently have paid leave. So currently 15 states and the District of Columbia and Puerto Rico have paid sick leave. And again, this is that short-term leave anywhere from a few hours to a few days. Colorado, New York, and Puerto Rico enacted the bills in 2020, which are now all in effect. Connecticut was the first state to enact paid sick leave in 2011. Most state paid sick leave laws apply to both public and private employers. However, some states such as Connecticut, Maryland, Michigan, Nevada, and Rhode Island allow for smaller businesses. So whether they're below 50 employees or even below 10 or 15 employees, they can be exempt from those policies. And then taking a look at paid family and medical leave. Again, this is the longer term leave. Currently 9 states and the District of Columbia have this paid leave. Oregon and Connecticut enacted legislation in 2019, and Colorado passed it through a ballot initiative this past year. California was the first state to pass paid family leave in 2002. And currently all the states except for Connecticut, Oregon, and Colorado are being implemented. In most of these states, paid family and medical leave is available to all private sector employees, and it's roughly half those states that offer it to public employees as well. And a few of them have options for public employees to opt in. As I mentioned, California was the first state to enact paid family and medical leave in 2002. It wasn't until 2011 that other states started to join. So you can see here the slow uptick of states starting to offer these benefits to workers. Paid sick leave, so again, that short-term leave, is currently tracking ahead. And I think this legislative session in 2021 will be really interesting just to see how states react and post-pandemic. So this is a little bit of an overview, and now I'm going to dive deeper into two specific examples of paid leave. So first off, we're going to take a look at Arizona. And Arizona enacted a paid sick leave through a ballot initiative. The law applies to all non-government employees, regardless of the size of the employers. Employers can require that employees satisfy a 90-day trial period before they allow the employee to take paid sick leave. Similar to other states, hours are accrued at a rate of 1 hour for every 30 hours worked. And this applies to both full-time and part-time workers. Smaller companies are able to cap the sick hours in a year to 24 hours, so essentially 3 days of sick leave, whereas larger companies must provide more in every year. Employees are paid their full rate of pay for any sick time taken, and the leave can be used for themselves or a sick family member. Most states also, similar to Arizona, include domestic abuse or stalking as reasons to take leave. And then moving on to an example of paid family and medical leave, I'm going to talk about New York. So the legislation was enacted in 2016, but it was not effective until 2018. Again, this is pretty common as it allows states the opportunity and the time to start collecting the premiums. New York's leave is available to all private employees and public employees whose employer opts into the program. It's also available to full-time domestic workers and those who are self-employed. Employees must meet a minimum work requirement before being eligible to take the paid leave. And one thing about New York is they do separate the medical leave with the family leave. So again, the medical leave is taking leave for your own health and some sort of medical condition, whereas family leave can be for a sick family member or paternity, maternity leave, welcoming a new child to the family. The temporary disability insurance covers the medical leave, whereas family leave covers the family leave. Workers cover the full cost of the paid family leave in New York. In other words, the premium payments into the insurance program come solely from the worker's wages and not the employer. Whereas the temporary disability insurance for one's own medical leave is split evenly between the worker and the employer. So both pay into that insurance program. Employees receive partial wages for their time off, roughly 2/3 pay for family leave and about 50% of their pay for medical leave. And the payments do max out at a certain point per week. New York just increased the length of leave from 10 weeks to 12 weeks for family leave, and medical leave is allowed at 26 weeks. An employee can take a total of 26 weeks per year of family and medical leave, so whether that's a combination of the both or just medical leave. New York is pretty similar to most other states with their paid family leave in that it is mostly funded by employees. The exceptions being the District of Columbia, which currently is funded only by the employer paying into the premiums. And then Connecticut, Colorado, Washington, and Massachusetts are jointly funded by the employer and employees, with some exceptions for those smaller businesses. And as mentioned earlier, states typically allow at least a year after the enactment for states to start collecting the premiums before the leave is available. One of the issues that I mentioned earlier and is brought up by opponents of paid leave is the solvency of the insurance programs. So in other words, if more workers take advantage or take the paid leave benefit in a given year, more than what is projected, will the insurance fund be depleted? And an analysis of some of the earlier programs in California, New Jersey, and Rhode Island have found no issues with the insurance fund's solvency. And in most cases, the funds have experienced surpluses. As a result, some of these states have expanded their access to the paid leave, which I'll dive into here in a little bit. And so now I'm going to hand it back over to you, Allison, to talk about what's going on in the states.
Okay, thanks, Suzanne. I appreciate that. Before I do that, I did want to respond a little bit, at least to Martin. I saw your question and I appreciate the question in the chat box. What employees are eligible is one of the many points to consider in crafting legislation. We'll share a bit more, but there's just a variety of variables. So whether or not you want to include gig or 1099 workers is sort of at your discretion as legislation's being crafted. So hopefully that gives some information, and we'll talk more about just all of the considerations in crafting policy. But now I'm gonna, as a visual learner, I like the next few slides. It's nice to see the action that's happening across the states. For right now, we're gonna hop in our little time machine and go back to 2019 and see what was going on in 2019. So the states in yellow are the 6 states in DC that already had paid family leave enacted through legislation. Noteworthy here is that 4 of those states, so California, New York, New Jersey, and Rhode Island, were already paying out on the benefit. The states in the blue color are states that introduced legislation in 2019. And what's interesting is you'll see a lot of those same states in the following slide, which essentially just indicates that this is a piece of legislation that comes up on a somewhat annual basis in many states. In 2019, we saw that Connecticut and Oregon enacted their policies. Benefits payments will start in 22 and 23 respectively. And in 2019, there was also enacted legislation in Colorado to create a task force to provide recommendations on 16 different elements related to paid leave. And then as we shift our attention to last year, of course, 2020 was a unique year with the global pandemic. Even so, we saw bills in a whole host of different topics, including paid family, medical, and sick leave. So last year, roughly 25 states introduced paid leave legislation, and at least one was enacted into law. We also saw Washington, D.C. and Washington State start to pay out on their benefits. Another noteworthy thing that happened in 2020 was during the November election season, where when 1.8 million Coloradans, which was equal to about 58% of the ballots cast, said yes and supported establishing a paid family and medical leave program. What's unique about this situation is this was a first. This was the first time, at least, that a paid family leave program was created through a ballot initiative and not legislatively, as in the other state examples. It might be interesting to see if this is the start of a new trend, at least in the states, primarily those in the west part of the country, that allow citizen initiatives. And now we're going to jump ahead to this year. And as many of you might know, the better part of the country is back in legislative session, which means introducing and enacting legislation. I've been tracking items across the country, and I found at last look, over 20 states have introduced legislation on paid family and medical leave. The bills that I am tracking are available on NCSL's Early Care and Education Legislative Database. I now want to just highlight a few of the pieces of legislation that have been introduced so far. Worth mentioning is I can't predict what's going to happen, but it'll be exciting to sort of stay plugged into this topic and see how the 2021 session shakes out. So the states in green have introduced legislation. Those in blue have bills that have already failed. And then the gray just indicates no action just yet. I can say from conversations I've had, I do anticipate at least one or more additional pieces being introduced over the coming days or weeks. So again, there is a fair amount of decision-making that goes into crafting the legislation that you're going to put forth. And some of that will come out in the examples that I highlight here. And later we'll talk even a bit more about just the variety of consideration. So some people, some states have very narrow legislation that they put forth. So that might include something like paid parental leave, so maternity and paternity leave only. And states like Arizona and South Carolina have introduced legislation for paid parental leave, both. And then there's an additional caveat with each of these examples, and that's that it would be for state employees only. Again, that's just a variation and a decision you have to make in crafting or helping to craft legislation. States like Kentucky and Indiana, just to name a few, we find some very nice bipartisan support with legislators on both sides of the aisle, either sponsoring or co-sponsoring the legislation. If we travel to the Green Mountain State or Vermont, they have a handful of interesting components in their pending legislation. So first, the duration of leave would be determined for the reason an employee is taking leave. So to better explain, the legislation says 12 weeks of paid leave for parental leave and 8 weeks of paid leave for family care. The legislation continues and it says, if enacted, the goal would be to identify a private insurance carrier to provide the benefits at what they call a cost-effective manner, more so than the state would be able. The legislation does also indicate that if they can't find a private insurance company, the program will be administered by the Department of Labor in coordination with the Departments of Financial Regulations and Taxes. And then a last note, even after states enact legislation on paid family and medical leave, we do see them come back and amend or update or make legislation to create a study committee to think about implementation. And I say this because both Oregon and Connecticut on this map are green. They've both enacted legislation and they're coming back to make some amendments right now. So just a little taste of what's happening across the country. Again, you can find all of this in the Early Care and Education Legislative Database. There you can actually find the introduced, pending, failed, and enacted pieces. You'll also have access to the bill text. The link for the database will be shared or has been shared in the chat box. It's also noted below the video player where you'll find resources for this session. So now I'm going to turn it back over to Suzanne. She's going to highlight some of the 2021 paid sick leave legislation that she's been tracking and also update a bit more on some of the more recent changes that the early adopters have made to their programs. Suzanne?
Great, thank you so much, Allison. So again, about paid sick leave. So far this year, we've seen at least 12 states introduce legislation to create a paid sick leave program. So again, that's that short-term leave. Many pieces of legislation are similar to those that we've seen already in place in other states, creating a program for workers to accrue 1 hour of sick time for every 30 hours worked. There are other bills, though, that are very specific to COVID-19 and protecting certain workers. So especially the healthcare workers and other types of essential workers. For example, there's a bill in Nebraska that would provide paid sick leave specific to those working in meat packing facilities. And Oregon currently has a bill that would help small businesses in providing their paid sick leave. As Allison mentioned, there are some early adopters of paid leave that have gone back or are going back to make changes to their existing plans. Most of these expand access and time for leave. So for example, California expanded their leave from 6 weeks to 8 weeks. And they've also expanded who can take leave to cover those related to military active duty or call of a family member, for example. New Jersey recently increased their wage replacement from 2/3 salary to 85% of the salary and increased the duration of leave from 6 weeks to 12 weeks. New York has expanded their paid leave to include instances of domestic abuse, assault, and stalking, as well as paid time for bereavement. And then again, as I just mentioned, Oregon has a bill to provide tax credits to small businesses who are already providing the paid sick leave that they have. And so right now we're going to jump into our second poll question. So again, it'll be just below the video. And the question is, which of the following are common considerations when drafting a paid leave policy? So if you can look at and answer that, that would be great. And I'm gonna pass it back over to Allison.
Thank you. I'll give you all just a quick second to respond to this question, thinking about which of these following are common considerations when drafting a paid leave policy. You see the numbers sort of shifting around. And it looks like close to 90% of you passed the test, and you knew that the answer was all of the above. So let me take a few more minutes of your time. So we've learned about all the activity that's been happening, starting with California, more of the recent legislation. And I think the next important thing to consider is that any paid leave policy, it's not a simple yes or no question. Instead, there's a tremendous amount of nuance and opportunity for you and colleagues in the legislature to really dig in and discuss, to make some decisions around how to proceed. So the next two slides are just some of the considerations that we see in legislation. And again, this might not be an exhaustive list, so feel free to pop anything in the chat if something comes to you. But when you're thinking about the type of parental or the type of leave, are you going to include parental leave, family care, medical, sick, or all of the above? So we've seen in some states they only do parental, and others it's a combination. Then when you're thinking about what are the qualifying events, bonding with a new child, caring for a family member or oneself during a serious sickness, what about military duty? Does that count as initiating a time of paid leave or serving as an organ or bone marrow donor? As we move to think about what employees are eligible, all employees, state employees only, private sector, independent, gig, 1099, self-employed, who are you going to include into the legislation? And what's the definition of a family member? And what we've noticed is over time, it appears that the definition of a family member is a bit broader now than it was. And we've even seen early adopters go in and update their definition of a family member. But we can think about, child, spouse, parent, grandparent, sibling, and so forth. This is a big one. Who's going to pay for it? Are employees only? Are employers only? Is it a combination of the two? Or is it something entirely different? As we move on and consider other things, what's the administrative mechanism? How are you going to make this work? So through a state's temporary disability insurance, as an example, in Rhode Island, something that exists already, or are you going to try to stand something new up like they're doing in Oregon? Or something else like a private insurance company, which we saw in the example that I pointed out from Vermont not too long ago. The wage replacement, how much can an employee taking leave receive? And is it based on something like the average weekly wage in your state? So are folks getting a full or a partial wage replacement? Is there some tiered reimbursement so that those lower wage earners might be receiving a larger amount of their salary back? And is there a maximum amount you can receive, which we do see in many states? Thinking about the duration, what is the right amount of time? Is it 4, 12, or more weeks? Does that amount of time also vary based on the reason that you're taking leave? As in, if you're bonding with baby or for your own medical, do you have some sort of, is there a differentiation between how much leave you can have? And then finally, these exceptions or waivers that might be allowed. So are all businesses subject to this requirement, or does the staff size, as an example, matter? Who can opt in or out of the policy? So again, really not just a simple yes or no question, lots of variables to consider. So in addition to these variables, there's also the need to balance and consider what the opponents and the proponents of leave have to say. So as a quick reminder, those in favor see mandatory paid leave as a significant opportunity. It's an opportunity to improve the health and well-being of children and their families. They see these policies as a way to safeguard family income and to also keep workers connected to the workforce. Opponents, on the other hand, think placing mandates on businesses can be burdensome, as well as perhaps overstepping the government's role. And of course, there's a concern around the associated costs of the program. So all things to consider. So I want to thank you all for joining us. We're going to move over to taking some time for questions, answers, discussion. I know we've had a few that have come into the chat. I'll give you all a few more moments to consider other questions you might want to ask. And as the person currently talking, I want to use my power and actually ask Suzanne a question first that I've been wondering. So I know that one of the most common questions that Suzanne gets from NCSL members really relates to the funding and the financing of paid family, medical, or sick leave policies. And so while this was touched on a little bit, I was really hoping, Suzanne, that you could share a few more pieces of information and information on the topic of funding and how you pay for this policy.
Yeah, definitely. Thanks, Allison. So first off, on the paid sick leave, in most of the states, it's just the requirement of the employer to provide that paid sick time off. So there's not an insurance program that is tied with that. As we saw during the pandemic, the federal government did offer a tax credit. So some states such as Oregon, as I mentioned, are looking at providing some of those tax credits to small businesses that provide the paid sick leave to their employees. But in terms of the family and medical leave, that's where we get into the insurance program. And again, it just really varies by state in terms of who's covering it and what the costs are. So a state could ask employees to cover anywhere from 0.1, 0.15% of their salary up to a certain threshold into the insurance program, and same thing from the employer side. These vary anywhere from a fraction of a percentage to 1% of their salary that goes into the insurance fund. And again, it varies by state on whether the employee is covering the bulk of it or if there's some combination between the employee and employer. And so Allison, I'm actually going to turn it over and ask you a question that I know you get a lot of the time, and then we'll address those that have come up in the chat. But how has the current pandemic impacted the level of interest that NCSL finds from their members or states in general on this topic?
That's a great question. And I do think that COVID-19 certainly has affected interest in paid leave rather broadly. I think it appears that this policy area, we find a lot of interest and support, and in particular, it can be really difficult right now, for parents to work from home, especially if their children are at home due to closure of childcare facilities or their school moving to a remote format. So state interest is sort of growing. What do we do with this? I think also there's part of the interest is related to keeping people safe while also ensuring that individuals have jobs to return to. And I think a last important thing to mention, why we might be getting increasing question or what those questions really are. This idea that essential workers are without access to paid leave. So there's a certain effect on them and their employers and their families. But it does seem that across the country, legislators and legislative staff are more interested in paid leave, and that COVID-19 has sort of made them even more interested.
Thank you, Allison. I'm going to go back, and it looks like we had a question. What can you say about leave policies for gig workers? computer starting to make a little bit of noise, so I'll keep this quick. But essentially, a lot of the states allow for gig workers or self-employed workers to opt into the program. And so essentially pay a small percentage of their wages in order to opt into that family and medical program.
Well, folks, technology at its best. Did you like that sound? It sort of sounded like they were pushing a lawnmower right behind her. So let's see, we have a few more questions, some of which I might be able to answer, others I might not. But let's see. Evidence on benefits of paid leave families. I'd actually point you, Roberta, there was a report that I authored in the fall of 2020 that is noted as a resource. And I think in there, you'll find a handful of resources that sort of outline the evidence behind the benefits, what studies have actually been done. I would also just point you, AEI and Brookings have done 2 reports on this topic, and they reference a lot of the research that's been done, and it's cited. So off the top of my head, I don't know that I could necessarily point you. Maybe Suzanne can if her computer is quiet, but I would definitely start with those few resources, and I can also follow up with you if that would be helpful. Let's see. I'm scrolling, guys, just bear with me. So Cindy, you asked an interesting question. There are a lot of variables. Like I just outlined 2 slides worth of variables. And so are we starting to see any patterns across the country? And that's a good question. And it's actually something that I heard not too long ago. And I don't think I'm really seeing anything that indicates like a real pattern. What I will say is this, what we've noticed is who is defined as a family member has grown over time. So I don't know if that's a trend or, what really drives that, but there are certainly more qualifiers for who is a family member than there used to be. And I think also I've noticed more states writing into legislation having a tiered reimbursement so that lower wage workers can recoup more of their salaries. There was one other thing I was going to mention that I can't think of right now. So if I do, I will get back to you. But yeah, I don't think that there's like, yes, everyone is doing this. And you sort of saw through those legislative examples, there's still a lot of variety. And some people are being really focused on just state employees. I will note that in the instance of Arizona, which I highlighted, while they do have this one piece of pending legislation only for parental leave and only for state employees, they also have 3 or so other pieces of legislation that are a lot more inclusive. So it's interesting to see multiple bills coming out of the same state. Yeah, Suzanne, is the computer really still making a lot of noise for you? Okay, I don't know. These are all excellent questions and I certainly appreciate them. I don't know that I necessarily have the answers to these questions at this exact moment. I see something coming in about what if you live in a state and you have paid family medical leave, but then another state office, how does that affect a company? I'll say 2 things. One, Washington, D.C. does have a paid leave benefit. So the comparison of people in Colorado and Washington, D.C. is a little moot, but who pays into it could be different between the 2. So this sometimes could be an argument for people who are not in support of paid leave. How do you balance keeping things straight from state to state if you have offices that exist in multiple places? This is one thing that opponents will say that's difficult, that's paperwork and all the rest. So it sort of depends where the states are. And also, do keep in mind, there are a fair amount of businesses that this is a benefit that they just offer to their employees for working there. So you don't always need to leave it to the legislation. I think to the point of common myth, I mean, I feel like we sort of busted that down. We told you the pros and cons. I don't know if there's one common myth. I do think that people really are pretty firm in one camp or the other. And so it's a matter of getting educated and understanding, like, okay, you don't support it, you're nervous about the prices. You do support it because you know parent-child bonding is so important. So maybe just breaking down some of the differences that exist in people's minds and sharing clear information. Yes. Okay, so it sounds like there is the one comment related to states versus, or the US versus others. You know, we don't really have information to compare US states versus other countries. And in fact, the question answer might have more information on this question. So that would be interesting. But if you have other questions, I'm going to look in the chat also. Okay. Well, I think we've answered some, and I apologize that we're having some technical difficulties, but it sounds like Suzanne's email has been added to the chat. Thank you, Laura. The session will be available for you to review. And I believe in our bios, actually, you can get to both of our email addresses. So some of these questions, while we can't necessarily answer them today, they are things that we could do a little research and provide some thoughtful responses, because they all are very valuable questions. So I think with that, I appreciate everyone. Please consider joining us next Friday, where we are going to be hosting the final installment of State Policy 101. You'll have some tough decisions to make, but I do want to call out at least 2 sessions. We've got one that's going to look at early childhood policy, another one that's going to look at bringing people with disabilities into the workforce. Remember that the archive's available and the resources behind, and I hope you all have an excellent rest of your day. Join the other State Policy 101s that are going on today and have a very safe weekend. Thank you all very much.